So good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for December 3rd. Last week we didn't do one because of Thanksgiving weekend. So if you need to call the Health Department, 508-495-7485. Our email is health@falmouthma.gov, and our website is falmouthma.gov. So cases are definitely on the increase like they are everywhere else. We're at 2,261 with 68 cases this particular week, 50-something last week, 29 probables. Those are higher numbers than we've had several weeks ago. Positivity has gone way up to 22.1, which is about 7 cases per day for the time frame of the 14th to the 27th. That's when the state gives us that incident rate. Our 14-day positivity has gone from 3.35 last week. It was in the ones the week before to 4.5. So definitely an increase in cases, which isn't surprising. The same thing happened last year. You can see this is the chart. If you go back right around November 20th, you started to see the increase. You see an increase from 20 to January. You're starting to see the same thing. I mean, the good news is if we have a vaccine, and generally speaking, and I'll show you a slide in a minute, that hospitalizations and deaths among vaccinated peoples remains on a much lower end than you would have not had a vaccine. But that being said, the cases have definitely got a 1, 2, 3, 4-week increase, and quite a large jump. You've seen that a few other times in the pandemic. I don't know whether that's just going to sort of taper off or not, but looking at all the other towns and in the state, you definitely see an increase in cases. You can see, and this is our chart, the flatter and more densely packed those circles are, the better we're doing flattening the curve. You can see that these far right, you can start seeing that increase showing up in this chart. This is the county numbers. So the far right is the more recent numbers, and you can see the increase over the last couple of weeks, indicative of the entire county, state, and so forth. So you're starting to see an increase towards a spike. Hospitalizations. So back in November, we were at 0 for 3 weeks, 2 weeks, and then we jumped up to 5. And the most recent one on the 11th, there was 11 in the hospital. So that's a higher number. Our higher numbers, January of 2021, were more 16, 17. We're not quite at the highest number, but that's a higher number than you're definitely seeing an increase in cases, increase in hospitalizations, mainly among the unvaxxed or those that have been vaxxed with weakened immune systems. Age and so forth. Good news is that the ICU, you're not seeing the ICU numbers, but you are seeing hospitalizations. And mainly that becomes the unvaxxed, and those, again, with the vaccine may not take well due to their personal health. State, we were in the 1,500 cases for quite some time, and 1,500 a day, and the state was about 25 or so in Falmouth, somewhere around there. You're seeing increase here, increase everywhere. They're at 5,000 cases. The positivity is now closer to 5. It was below 2 for some time. So all the, it gets dark, gets cold, people are indoors, people are getting together, it's happening. So that all these trends will start showing that upward trend. Hospitalizations, deaths are not as, again, vaccinations, high vaccination rate, that's not going to spike as much, even though there is a bit of a delay. So you might start seeing an increase because there's a delay to the deaths. Usually there's a lot of hospitalization time before that for most. But testing, the two upper ones are telling you the cases and the positivity are on the upward swing. Looking at our peers for incidence rates, all these numbers are up for the most part. Falmouth falls at 23.1. I think I accidentally put 22.1. Sorry about that on the upper slide. So we're still in the mid-range for what other towns are seeing for incidence rates. Still high for us, but amongst our peers, we're sort of on the lower half, which is good. But obviously, we just got to remain diligent. And everybody's going to take personal responsibility to help keep the numbers down. Positivity also in the mid-range. Some towns are over 8, quite a few towns over 7, and most towns appear to be over 5. 5 is considered low, anything under 5. I'd like to really see that under 2 because once you get over 2, you'll start seeing an increase in cases, 2 to 3%. You want to keep it under that. This is a good slide. This tells you that there's been 77,647 breakthrough cases. However, the hospitalizations has been 2,443 or 3.14%. I had this slide up previously in past presentations at weekly updates, and that number's been around 3.75. So you're not seeing necessarily a jump in hospitalizations, maybe as you see the vaccine waning and people may not have boosters and so forth. That number's not showing as hospitalizations among cases, and the 0.75 deaths among cases, less than one, has been pretty consistent. So you're not seeing you're seeing obviously more hospitalizations and deaths among vaccinated, but as a percentage of all people who've been vaccinated getting it, you're not seeing an increase in the percentages, which is a good sign that the vaccine's been effective. Again, if COVID gets to a point one day where it's just causing minor illnesses to 99.9% of the population, well, then it's just another bug that we get. So these numbers to me are important to show that the vaccinations are effective. From a vaccination standpoint, went up 1%, so the entire county is 76% fully vaccinated. Among the entire population, 83% among those that are 12 and older. That's how the state tracks that. Our vaccination rates are good. I've been asking the state of where booster shots lie in this. Are they falling into this? I think they are. We've done 963 doses among the last 2 weeks. I did 2 weeks because last week I didn't do a presentation, so I just added last week's to show that we've done almost 1,000 doses in the past 14 days. But the booster part, there's not a separate column at the state level from looking at it. I've actually asked the state again today. I don't know if the pharmacies may not be putting them in. I don't know if they're counting them as first or second, which kind of, if the state's going to show us first and second, they should also show us boosters. But that being said, 963 doses are 963 doses, and we'll definitely take it, okay? The most increase that you'll see is, again, obviously, we just opened up to 5 to 11-year-olds, and we're at 32% first doses. It hasn't been enough time to get a lot of second doses in yet, but 1/3 so far of 5 to 11s have taken advantage of it. So there's our vaccination rates. I'll post this also on our website. As far as vaccine availability, you may have noticed if you tried to get a booster since the governor opened it up, the state opened it up to 18 and older, there might be a little bit more of a wait. Again, you open up from, a third of the population might have been eligible before to 2/3. When you open it up to a lot of people, you're going to have a lot of demand initially, and that'll taper off. And I think what you're seeing now is you might have to wait a week or so before you get one at the pharmacies because it'll take a little bit of time for the pharmacies to get through that original the original push when the guidance opened up. When it opened up to more people want it, the slots get filled. But there is, I go on there, I've seen them about a week or so out, maybe 2. Again, you can get that through VaxFinder. Barnstable County's office is doing it, pharmacies, Convenient MD, Community Health Center. Anybody who's homebound, call the health department, and we'll send somebody out from the VNA. So there's, availability. There may be some clinics being run, the health department. We can definitely get some stuff done as we see it. I've just been sort of keeping an eye on it. It doesn't, if the pharmacies catch up in relatively short order, there probably wouldn't be a need for it. But if it seems like they're struggling, then maybe we need to do something as far as having more clinics. As far as testing, nothing's changed. The schools are still doing test and stay. Convenient MD is still a big hitter. CVS, Falmouth Hospital with appointment from your physician. The fairgrounds, I think, are Monday and Thursday right now from 4 to 5:30, and the Community Health Center. If you need to get a test. Booster doses are eligible for anyone 18 or older. You can mix and match. If it's been at least 2 months, actually, if it's been 6 months for Pfizer, Moderna, and 2 months for J&J, you can get a booster. I recommend that you guys get a booster. I think all the data shows, at least with Delta, that it's highly effective, very highly effective, getting the booster. So I recommend that you get the booster. If you've already gone through and committed to getting the vaccine the first time, get the booster. And you can mix vaccines if you choose. So you are able to do that. If you cannot use a computer to do that on VaxFinder, you can dial 211 and talk to someone at the state who can help you schedule. So that's it on boosters. I highly recommend that you do a booster dose, especially if you're high risk or above 65 years old. You definitely should. Vaccine for 5-year-olds, it's a 1/3 dose of Pfizer. Pediatricians have them. We've run some clinics already at the Falmouth Public School System. And looking at the vaccination rates, it was 549 first doses and 135 second doses have been done around the 1,700 or so kids in that age group. So like 32%, like I said before, 32% have had first doses. There's a couple of oral treatments. I had talked to this a couple of weeks ago. There's a couple that are close to being approved that should hopefully help things, especially those that are milder cases, and helps them keep, an oral treatment keeps you from getting in the hospital. That's great. Omicron, again, I'm not going to get into too much detail because we're still waiting. Further information is due in the next couple of weeks about this transmissivity, the severity, the efficacy of the vaccines, and the efficacy of your previous infection if you've already had it. Does Delta or having Delta before mean anything? I think I just read some study in Israel that says it's probably not quite what we would hope for people that have had previous infections. But we'll get, I don't have a lot of data to give you, and I'll give you that as, the news. The news will have it as well, so. Face coverings, we still remain in an advisory right now. The state is, requires if unvaccinated or vaccinated with a weakened immune system should wear them, and still required on public transportation, still required in schools. However, the cases are going up, so, the Board of Health will get this data, and will, they'll talk and decide things, perhaps, in the near future, what to do in terms of, further, mandates or things of that nature, mitigation procedures. But we're definitely, on the higher side in our incidence rate. Our positivity still is on the low side, but again, it's creeping up by 1% or 2% each week. Our hospitalizations are up. I don't think they're not at surge capacity. They were able to handle it in the teens, but that's still both trending in the wrong direction. So our cases are trending higher, and our hospitalizations also as well. But again, going back a few slides, that it comes a point where if these are cases, and those that have been vaccinated, that we show that the hospitalization rate is still in that lower threes, a little over 3%, that, the board's going to have to take that into consideration at some point. And, we had a meeting on Monday night, and, they have this information, well, not this most recent, I just finished this about 10 minutes ago, but, so I'll share this with them, and, we'll continue to talk and work from there. Our vaccinations, again, have always been strong, but we're definitely seeing the same increase that everyone else is seeing. So everybody's seeing an increase, so are us, so are we. Maybe not to the extent that some other places are. Going back up a few slides, you saw that we were sort of the mid half of our peers over here on the Cape, on Barnstable County. But we still got to look at it, and, individuals need to know that, if you're high risk, and even though you've been vaxxed, you should get boosted. If you've been boosted, masks help mitigate as well. Limiting your activities, things that you consider, again, based on your immune system and your individual health and your individual tolerance, that, to look at what kind of activities that you've done, and what you've been currently doing, and make adjustments if you need to. So if you're somebody who's got a weakened immune system and you've not got your booster, well, you need to talk about getting your booster. It's up, of course, it's up to you. Also, wearing masks in public spaces indoors, if you're, thinking about things of that nature. So start thinking about different things, and of course the health department needs the Board of Health is also, keeping this under advisement as well. So any changes that may occur, we'll definitely get that out there. So again, as a recap, case counts are rising locally and statewide, definitely an increase. Same thing happened last year. It doesn't surprise me. Anecdotally, let's say pre-COVID 2018, is 60 cases of the flu, was that a high number for us? I don't know what a high number is. I don't really have a lot to compare to. I can only compare COVID to itself. Last year, you're seeing an increase. I think all respiratory diseases increase this time of year, so it doesn't surprise me that you're going to see an increase in COVID. The good news is that the vaccines are highly effective, especially if you have a booster. If you want to take extra precautions right at this point in time, definitely take extra precautions. But it's my job to tell you that the counts are definitely going up. And they'll probably stay on the elevated for, the next, I would say at least the next 6 weeks, we'll see on a higher count, would probably be my guess. Eligibility, consider a vaccine if you haven't at this point. Not everybody's going to get one. It is what it is. I'm not here to talk to you about that. I'm saying that, I'm definitely saying if you're committed to having the first 2 doses of your vaccine and you haven't been boosted, you really should consider that. And await more information on Omicron, so I don't have a lot on that. So that's where we are this week. And of course, we'll continue to do these updates every week. So that's it for this week, and I'll talk to everyone next week. Thanks.